Hi, Dr. Shevers. How are you today?
Good. How are you?
Good. Well, we're with Dr. Noel Shevers from San Jose again, and let's see what we're going to talk about today. What did you want to share today?
Well, today we're going to talk about acute low back pain and how it is often treated, and the symptoms are usually the thing that's treated rather than any underlying cause, and how that when you just mask the symptoms, that bout of acute low back pain that you got from picking up a bag of groceries can then develop into a chronic condition that leads to years of pain and ends up hitting you in the pocketbook quite hard, because instead of dealing with the problem initially, you've let it go to the point that it can no longer really be fixed, and you're just dealing with chasing the symptoms around.
Didn't you? I think we spoke about someone. I don't know if you remember. There was someone you spoke about, an actual case situation where I believe it was a gentleman that came to you and he had something that was kind of old. Do you remember what I mean?
Yeah, it was like when somebody had a car accident with and had neck pain and had not really dealt with it until many years later, and it had led to all kind of arthritic changes of the spine, and it then couldn't be dealt with. But with the low back, it is one of the most common causes of people taking time off work. About 80% of acute low back ends up in their primary care physician's office, and they're prescribed some kind of muscle relaxant or an anti-inflammatory and a painkiller. And 20% of those cases then become chronic low back pain, which becomes much more difficult to deal with, versus if you actually, instead of just dealing with the pain, but deal with the underlying structure, the muscles, the bones, and the joints in the low back, when the injury occurs, you can stop that from becoming a chronic problem. And those things aren't going to be corrected by taking ibuprofen and Flexerol. And if you go see a chiropractor, and they can not only help you get the pain under control and get the body healing itself and get everything working the way it's supposed to, one of the most important things the chiropractor can do is, at the end of those 5 or 6 or 10 visits that they've got that under control for you, is that they can put you on a stretching regime or give you the exercises and help you use a foam roller, which are all things that then, if you incorporate them into your kind of daily life 3 or 4 times a week, you can just avoid those problems forever down the road. And it then just becomes a great investment in yourself to to just never have the problem except when you've actually injured it, rather than you just wake up and you're in pain. I mean, who wants to wake up and for no reason not be able to get out of bed?
Yeah, and then not have to take the pain medications either, which with their side effects.
Yes, and on top of the fact, if you live on ibuprofen and Flexerol, at some point your liver is going to have something to say about that.
Yeah. I think of all my family over the years, how when I think of relatives, they pretty much just live on painkillers. Have a headache, take a painkiller, back pain, painkiller, and they just don't think twice about it. I mean, unless people understand this, which I'm sure more and more people did. I mean, I didn't up until maybe 20 some years ago. I would be living my life that way now. So this is really great for people to really become aware of this. And was there anything you wanted to add before we end it for this conversation?
No, I think that's pretty good for this afternoon.
Okay. All right. See you next time.
Okay, we'll talk to you next time.